So I'm here to introduce Dr. Adam Kibel, that doesn't need any introductions, and an expert in prostate cancer. He's been as a speaker here in Jackson Hole, and I'd like to thank you for the time you're spending here with us. And you're here with Grant, and you had to drive, so this is all great.
No, it's been a wonderful experience.
So I just want to actually get your thoughts, understand a little bit more about Adam Kibel and your thoughts as a leader and one of the most well-established institutions in the world. And what are the challenges that you now see with the change of healthcare? Do you think that things changed a lot? And if yes, what are the major challenges right now for you as a chair?
So, change is inevitable in our field. It's one of the things that I think draws us to it. The ability to change care of patients and not to continue to deliver the same care that was delivered for decades and decades and decades. And so you have to embrace change. Does that come with challenges? Absolutely. The ability to deliver the highest quality care is getting increasingly expensive. We have to figure out ways to provide value, and that's not a euphemism for just cutting costs, but to not overuse things that we don't need to overuse and save our resources for things that will actually benefit patients. And I think that's our challenge. I think the challenge will also be, as we continue to innovate, how do we innovate in a way that is done, again, in a way that respects how much those innovations can cost, and take resources away from other important aspects, not only in healthcare, but in society at large.
Yeah. So in terms of your faculty, the gauge or the thermometer of accepting changes due to the top-down type of challenges, how do you manage those challenges? How do you present to them?
I think one of the most important things is to be, honest with people about what you can do and what you can't do. To try and frame things in a way where there are certain advantages to doing things in a way that provides better care. So, for instance, if you develop an innovation that allows patients to get out of the hospital a little bit sooner, or a little bit safer, so they're at home in an environment that they like better, which costs healthcare less money, but also provides better care, of course people embrace it. I'm very fortunate to have faculty that I think thinks an awful lot about this the way I do, and sees this as a potential opportunity. Does that mean there's no frustrations? Of course there's frustrations. We all live with frustrations. I think that's not unique to healthcare. I think that's unique to any industry. And I think what's key is to look at those frustrations, not allow it to make you angry, but instead make it you think about how you're going to find a solution to this.
So you are a family man,
Yeah.
A great scientist. You probably have the schedule of your life is so tight,
Yeah.
and you got to manage very well.
Yeah.
What do you do for your burnout so you can prevent it? How do you relax? Tell me a little bit about Adam.
Well, I'd say skiing helps prevent burnout.
Yeah.
I exercise a great deal. I find that when your mind is concentrating on the exercise as opposed to other things, it relieves a lot of strain, mental strain as well as physical strain. I also think I have some of my best ideas, actually not on the ski slope. It's a little steep for me to be concentrating on anything else. But when I go, I like to run, and when I go for a run, often, there's one or two ideas that pop into your head, mostly because your mind is sort of decompressed and is able to think of that thread that is not overwhelmed by all the other stuff that's going on. I try very hard to spend time with my family. It's one of the things that I think we all worry. Anybody who's in an industry which requires a lot of time worries that we don't do enough of. But it is a priority in my life, and I make sure my family understands that and tries to do the best that I can.
It is amazing how much you have to travel and do a lot of things, and spend time with your kids. Where is home for you? Where did you grow up?
So I grew up actually in Newton, Massachusetts, about a mile from where I currently live. People often say, why did you move back home? I did move back home, but mostly my wife also grew up about a mile from where we live. And so, again, moving back to familiar surroundings for both of us, I think was incredibly important. So I grew up there, spent really all the way through high school, then went off to college in upstate New York at Cornell Med School. Then when I went back to the Brigham for my residency, then fellowship at Hopkins, and then I was fortunate enough to go to Washington University in St. Louis for another formative 10 years of as a junior faculty member, and now I'm back in Boston.
How hard was for you, how challenging was to go from the old open surgery, not old, actually it's very new, we got to continue to do that, but from that type of culture to a newly presented robotics, new, innovative, minimally invasive procedures.
So I didn't make an acute change. It didn't like I went from open to robotic surgery. When I did my fellowship at Hopkins, it was in basic science, but I was very fortunate to be able to observe and work with Lou Cavussi and the team there that was really innovating in the laparoscopic environment. I already knew Lou fairly well because when I was a medical student, he was a junior faculty. I visited at WashU, and then he was a junior faculty at the Brigham when I was a resident there. It just shows how those early interactions really can have a huge impact on your life. Yeah. So I became convinced that the future of oncology was in minimally invasive surgery. Not that there was going to be no role for open surgery, but things like small renal masses, even larger renal masses, even bladder and prostate, that's where the envelope was going to be pushed. And so then when I had the opportunity to go to WashU and not only have a lab and grow that piece of my academic persona. Ralph Klayman was there, and when I was interviewing, I said, "Ralph, I think this is the future of oncology. Will you help me learn how to do laparoscopy?" And he said, "Yes." So I learned from the best.
Yes, yes.
Jamie Landman was a fellow there at that time, who's now the chief at Irvine, and the two of us worked an awful lot together. And then when robotics came along, that was just an incremental change from laparoscopy. I was already doing laparoscopic cystectomies, prostates, kidneys, partials, and so having the robot was just an added tool, a sharper pair of scissors, as it would be.
And now, what kind of patients do you see?
So I see pretty much about 90% prostate cancer. I still see some bladder and some kidney. When I was in St. Louis, I had a practice that was much more a third, but currently it's almost all prostate. The majority of the patients have high-risk prostate cancer, which we put on innovative trials in order to improve our care of those patients by putting them on neoadjuvant, adjuvant protocols, using biomarkers, trying to take those patients that are they're the patients who we're worried are actually going to die of the disease, and how do we provide a more intense therapy as opposed to a less intense therapy, with the goal of improving the cure rate.
So for the fellows that they do fellowship, they have somebody that have established practice in only those kind of patients, and now the fellow is going to an academic center. How would you present to the fellow, some advice or the reality, because they think that they're gonna see 99% of the patients that they were trained during the fellowship. I don't know, is that real? Is it possible nowadays?
No, I tell them, so from a clinical perspective, I tell them not to be a one-trick pony. Okay, you want to do everything to begin with because you never know what's going to happen. Right. I think about the cardiac surgeons back when I was finishing my training who actually had trouble finding jobs because of the incredible increase in angioplasty. Now that's been reversed, but for a period of time people had problems. And so you want to treat cancer and then go to an institution where you find where the need is and allow that to grow organically. It's not only better for you clinically, because you learn so many important skill sets. I mean, just to use myself as an example, would I be able to do robotic prostates if I hadn't learned how to do laparoscopic radical nephrectomies? No, I needed that in my armamentarium as I move, and going back and forth. The skill sets are incredibly important. But also, so you not only have that piece where you get the skill set, you not only have the piece that you're not a one-trick pony, but also you have the skill, the ability to interact with multiple different individuals in your environment and develop an academic, a research program that dovetails nicely with the kind of patients that you end up seeing. And the more opportunities to do research, the more interesting research projects you're going to have, and the more successful you're ultimately going to be academically.
That's right. So you have kids now that they're going to college. Yeah. What is the one advice you give to them before they leave home?
Well, my kids give me a lot of grief because I give them a lot of advice. There's a lot of little aphorisms that we say. So one of the aphorisms I think that is suitable to put on videotape is, I'm paraphrasing this a little bit, but Thoreau said, man usually hits his mark, so aim high. Which basically means that reach for that high-hanging fruit, because you're surprised how long your arms are, and you can actually reach it. And the act of actually reaching for the fruit actually is almost as important as actually getting it and eating it. I also tell them to have a lot of fun. You know, you only get to be 18, 19, 20, 21, 22 once, and you don't always appreciate it until you get a little bit older. And there are things that you can do, from skiing terrain here at Jackson Hole to even intellectual pursuits that, as you get older, get harder and harder to do because you either don't have the time or the energy or the inclination. So live large is one of the things I tell them. Adam,
thank you so much. Yeah. It is just basically an honor for me to interview you.
The honor is all mine. This is such a fantastic course. You'll learn so much. I learned so much. And I really think the interaction between the critique panel and the speakers is unique. And that's really where a lot of the action happens. Where people ask a question, that triggers another question in your mind, and it's incredibly engaging for everyone. So thank you.
Thank you. Thank you very much.